Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dawn from Soteria Wellness Holistic Therapies. We learned so much from Dawn in our 4 episodes together, including tips for prioritizing self-care and the power of massage therapy in episode 1, the surprising benefits of bodywork for kids of all ages, including special needs, in episode 2. Then in episode 3, we talk about how much breast health matters, and she gives some expert tips for cancer prevention. And then in part 4, we talk about exploring holistic therapies by thinking outside the box, maybe some therapies that you haven't heard before. These were all amazing and very, very insightful discussions. But a little bit about Dawn. She is a national board certified and Wisconsin licensed massage and bodywork therapist who holds advanced certifications as a craniosacral therapy diplomat. She's a prenatal, postpartum, and infant massage therapist, an advanced metacupping practitioner, a lymph star technician, and a level 4 touch for healing specialized kinesiology practitioner. Woo! She is incredibly smart. She has so many certifications, and she really knows what she's talking about. She is also an internationally accredited emotional freedom technique, or EFT practitioner, and a certified essential emotions coach. Dawn began her journey working with parents and babies as a home daycare provider, natural childbirth teacher, La Leche League leader, and doula while homeschooling her 3 children. I would say superwoman right there. In 2009, after seeing the profound pain relief that craniosacral therapy brought her mom, she began her journey into the world of bodywork and massage therapy with an early emphasis on working with growing families. Soteria's motto is enhancing optimal health throughout the lifespan. And Dawn loves working with all ages, from infants to elders. She loves to empower individuals and families with tools for natural wellness and truly believes in the body's innate ability to heal itself when given the right support. When Dawn is not in the office, she enjoys practicing what she preaches about self-care, receiving regular body work, reading, spending an abundance of time in nature, and hanging out with friends and her 3 adult children and their partners. All right, we can't wait for you to learn from Dawn, so let's dive into today's episode.
Hey guys, welcome back to the podcast. We're super excited you're here, and we're super excited to welcome Dawn back from Soteria Wellness. Welcome back, Dawn.
And thank you so much. It's great to be back.
Yeah, we had a great conversation in the first episode, all about self-care. Self-care isn't selfish. We've had a ton of information about that. We hope that you listen to that. And we did talk about body work and massage in the first episode as well. But this episode, we really want to delve into more pediatric, infant massage, teenage athletes, all that stuff. So let's start with just maybe infant massage. So let's talk about, body work. How is it beneficial for babies? Maybe when would you start that? Can you talk a little bit more about that?
I think the biggest thing is to look at it from a perspective of how beautiful and healing human touch is. And especially between a parent and a child, or a caregiver and a child. So our take on infant massage, sure, we could do it, but wouldn't it be so much better if we can teach parents who are there at 3 o'clock in the morning how to do some of these techniques that might help bring some relief to, their baby or their young child? And how do we, involve parents in that journey? According to Sharon Heller in her book, The Vital Touch, in a patch of skin that's 3/4 of an inch square on the back of the hand, you will find 9 feet of blood vessels, 13 yards of nerves, 600 pain sensors, 9,000 nerve endings, 36 heat sensors, 6 cold sensors, and 75 pressure sensors by the time we're grown.
Wait, how big of a spot? Like tiny?
3/4 of a square inch. And that's on the
Wow.
back of the hand. That's not like our highly sensitive fingertips.
Yeah. Right.
So it's not, we have to translate down for size. But I mean, that is the power of human touch. And all of that is being activated when we are touching somebody else, or even when we're touching ourselves and, doing some self-massage work. So for babies, it's like touch is their language. And so many times there are things that I might be doing in a session when I'm working on somebody's baby, or I notice them doing even as they're holding their baby. And I'll say, do you realize the impact on the nervous system of how you're holding your baby right now? That's really beautiful. And, kind of cue them into, well, why does that work? And how does that work? And, oh, that's why that always calms them down when I hold them that way or when I do that. So I really love educating parents and helping, especially first-time parents. They need that confidence boost because they don't come with their own unique written instruction book when they come out.
I love what you just said. Honestly, I wasn't expecting you to give that answer. I was thinking you were going to go more like bodywork is beneficial for infants because after they have the birth experience, their body is probably holding a lot of stress and things like that, which maybe you can touch on as well. But I think what you just said is so beautiful in a way of when you have a new baby, at least this is my experience. Maybe not everyone is like me, but you feel like you're failing in a lot of ways. You're just trying to figure out everything, whether it's feeding or why are they crying or just how am I still going to be a good spouse? I can't even cook dinner. You just feel like you're failing in a lot of ways. And what you just said about like the way you're holding your baby is so beautiful. And like, that's amazing. That's like a victory moment, right? It's like a way that you can feel successful and like you are doing things well, even though I will tell you, you're doing a million things well. But the way that you just said that, I just got goosebumps because I'm like, wow, that's just a moment where a parent, especially if you're teaching them how to do it, where they can be like, I have control over this, right? Control is a big thing you're searching for in that phase of life. And I'm doing things well for myself and my baby.
And I love that you teach them. Like I can just sit there. I could just imagine myself sitting there and, somebody like you who has all this experience and you're a professional at this and you're telling me like, hey, how you're holding your baby is exactly what they need. And I'd probably burst out crying. I'm just thinking, I bet you've had experience with that too.
Absolutely.
Yeah. I know another thing that you do, which is huge, and I believe really what started your whole career was the craniosacral therapy for infants too. Can you delve into that too?
Sure. So craniosacral therapy is different from massage in terms of we're not, rubbing or massaging the body. It's a very, very light, gentle holding. And sometimes if you think about massage, if you've ever had one, especially like a deep tissue massage, it's kind of like, it can be kind of a lot of force and kind of working into the tissues to try and break things up. Where with craniosacral therapy, and in my case, I blend a lot of myofascial release in there. It's more like melting into the tissues. So very light pressure, even in adults, we kind of start out with the weight of about a nickel and allowing the tissue to just relax and release and then go in a little deeper.
So when would a baby or even an adult, but let's focus on babies here, when would they be a candidate for craniosacral therapy?
I've worked on little ones at a day old. So, sometimes the birth journey can be extra challenging for babies. And, they're the ones that especially are going to benefit from early body work. One of the things that I do maybe a little bit differently is I kind of look at a less is more approach with the little ones. So not necessarily seeing them every week, but giving the body the suggestion of change and then allowing them a couple of weeks to kind of grow into that suggestion of change. And then we can give the body another suggestion of change because they're growing so rapidly that oftentimes it doesn't take very long sessions or very frequent sessions to help bring their bodies into a much more balanced, comfortable place.
So are you suggesting that it would be beneficial for every baby to have craniosacral therapy after birth because coming out of the birth canal or even via C-section, just being in the uterus for so long, the skull needs some help in getting in the correct formation, or what? When would they actually when do they need it, and when is it beneficial? Is it beneficial for everyone?
And how does craniosacral therapy, what does it actually do? Right? So what does it actually do?
Sure. Why don't we start with that?
Yeah, why don't we start with that?
Great. So what it does when we say we're working with the craniosacral system, we're talking about working with the meninges, the covering layer that surrounds the brain and spinal cord. So this is kind of a continual layer. It's not just, one area. But because we also have all of those cranial nerves, all of those spinal nerves coming out from there, it's going to have a whole body impact. Those nerves are feeding the muscles, they're feeding the fascia throughout the body. Our fascia is like a 3-dimensional spider web. And if you think about a spider web and you kind of pull on one part, you can see it pulling on the opposite part. So I might be, working on a baby's head while I'm working on their feet.
Yeah, that's really interesting. So circling back, do you feel like it's beneficial for every child to have a little bit of therapy, craniosacral therapy, after they're born?
In a perfect world, if there were enough craniosacral therapists around, I think that would be absolutely lovely to just give them that start in life. Realistically, I understand that we are not at a place that's going to happen. There was actually, I believe it was the University of Michigan, in one of the osteopathic schools where the babies born there would receive a treatment before they went home.
That's amazing.
Oh, that's cool.
Are there certain symptoms that babies may be experiencing where someone would refer them to craniosacral therapy, where it's like, this is a therapy that will help this specific symptom?
The things that I get the most referrals for are issues of head molding that's not correcting on its own. So kind of like, my baby's head isn't looking right, or, a referral that said, this might be a therapy that could help. I'm not physically moving the bones. It's more like using bones and ears as handles to release the soft tissue inside so that those bones can go back into place. So that's kind of, a difference between, say, craniosacral therapy versus, something like chiropractic or something like that. Sometimes people are wondering, it's like, well, how is that different? So it's kind of working into those soft tissues without the intention of necessarily moving a bone or a joint. Or
that helps definitely. Now, you had mentioned myofascial release. What is that, and how is it different than craniosacral therapy?
Like I said, I blend those two a lot, just because I'm trying to look at what does this person in front of me, baby, child, adult, elder, what is their body needing today? And so it's actually kind of hard for me to distinguish the two when I'm working. But where the craniosacral therapy is going to kind of have as its base that focus of that craniosacral system and how is that balanced. Myofascial release is going to be a little bit broader in terms of, where am I noticing fascial restrictions in the body? So those can show up as areas of, tightness or tension, or, maybe arching patterns in a newborn. Or, well, how come it looks like they're in this backward C shape, or the reverse, or their belly's just always so tight all the time and they seem so miserable. Some people will call it colic, or whatever, sometimes it can just be bound up restricted fascia from the birth process.
That's really interesting, especially parents deal with colic a lot. And so even just trying something like with massage, craniosacral work, myofascial release, I could see that helping in even one session.
Absolutely. Especially in babies, they respond so
Amazing.
quickly.
Yeah.
Like you said, oftentimes it is a one session or maybe one session, and then I can show you a couple infant massage things that you can do at home that'll help, or a couple little movement things you can do with baby that'll help.
Yeah. I want to move to a little bit more school-aged kids, and this might kind of blend in with babies as well. But are there types of therapies that are important to help support growth as kids are growing? The first thing that comes to mind is, I have school-age kids, but we still sometimes deal with things like an ear infection or constipation or things like that. So what types of therapies do you offer that help support growing kids?
Sure. So specifically the ones you mentioned with, the growing pains, the digestive stuff, the earaches, that's a place that craniosacral myofascial side of things is really, really going to shine. Growing pains massage as well. Bringing in essential oils into, the picture for actually any of those that you mentioned can be very, very helpful. We do a lot of work with that too. Obviously, when you're working with young kids, the younger they are, the more they need to be diluted before you're using them on your kiddos. I didn't mention it before in talking about babies, but this can impact those school-age kids too, especially as maybe they're starting to look into orthodontia. And that is oral ties, so tongue ties, lip ties, cheek ties. And that's something that even back in my early on natural childbirth teaching, La Leche League leader days wasn't really talked about very much. And man, I wish I would have known with my first. Because we had a really difficult start, very, very difficult start. And, now knowing what I know, I'm like, oh my goodness, like classic, every box checked, with that one especially. And I can't actually diagnose ties, but sometimes I am the first provider that somebody sees, and I might refer them, to a lactation consultant. If there's any kind of feeding issues, it's like, see a lactation consultant. And then potentially to, a pediatric dentist that does, releases to be evaluated. And using the craniosacral therapy, myofascial release type things are super, super beneficial, both before to prepare the body, if it's an option, or afterwards, because if you think about the floor of our mouth and our tongue, that fascial line through the body goes all the way through our core, through our pelvis, down to the bottoms of our feet. I actually had a release done about 1.5 years ago myself, in my late 50s, and totally changed ongoing issues I've had for years and years and years with my C1 being completely unstable because the fascia was so tight, even with all of the body work I've had. It was just a regular issue. And I got in the car to go home and I went to check my blind spot and it freaked me out because it's like, oh my goodness, I can turn my head to the right. What's that?
Wow.
I feel like we could do an entire episode we will eventually do an entire episode on tongue ties because my husband actually has had his released as an adult a couple of years ago. So I feel like this is becoming more mainstream and understanding how important it is within our entire kinetic chain.
Absolutely.
And throughout the lifespan too.
Throughout the lifespan for sure. Yeah.
Yeah. Now, what about, let's talk about athletics. What's your take on athletics in kids these days? So kids are starting at a younger and younger age of doing these, whether it's high impact sports or just repetitive sports. So obviously there's some benefits to high impact with bone density and things like that. But what are you seeing? What's your take on athletics these days for kids?
It's kind of a loaded question because I'm on the side of things where I'm seeing the problems. And I know there are benefits. I have concerns about year-long same sport. I have huge concerns about the number of kids that I'm working with head injuries and concussions. TBIs are not something to be messing with, and they're happening younger and younger. I have big concerns with, some of the injuries I think maybe are because there's not that break. They're always doing the same sport all year and there aren't breaks. It's like, I think back to, like when I was a kid, most people, maybe they had one thing they did that lasted for a few months. And it's like 12 months a year. And that to me is kind of concerning.
Yeah. What do you see? When do you see kids come in to your clinic? Like when are people, what are people coming in for typically? And what kind of therapies do you use to support them?
Most often it's injuries, when we're talking about the athletic realm with the school age kids, teenagers. And yeah, it just, like I said, that's the side of it I'm seeing. So my take on it's probably going to be a little bit different. Post-concussion care.
Okay. What do you do for post-concussion care?
Craniosacral therapy
Okay.
can be super, super helpful in, managing some of those symptoms as long as there's, kind of like active bleed is passed.
And I understand you do medicupping too for teenagers and up too. Can you talk
even
about
kids.
that?
Kids. I've done medicupping in 2-year-olds.
Really?
Yeah.
Okay.
And I think it's pretty cool because they get to hold some of my other cups and play with them while I'm working on them.
Well, what is medicupping?
Yeah.
And how do you use it? And tell us about it.
Sure. So medicupping, cupping itself, people started to become more aware of it a few years back when they'd see the Olympic athletes with these big circles all over their body. And it's like, oh my gosh, that looks horrible. That looks so painful. And actually it's kind of drawing stuff out of the body. So that's why you see that coloration. It looks like a bruise. It rarely feels bruised afterwards, but it just has that appearance. We use a machine that actually is somewhat similar to a breast pump in terms of it can have a pumping action, but we can also turn that pumping action off if we want a more sustained suction. So instead of pushing into the tissues, we're lifting and separating those adhered tissues. So it's super, super helpful for the athletes. We can also go super, super light, moving away from the athletic realm. And it's a powerful, powerful tool for moving lymph.
Yes.
So you have those kiddos that get the chronic, swollen lymph nodes and ear infections and that kind of thing. We can go really, really light, opening up those lymphatic pathways, helping drain the eustachian tubes. So yeah, multiple uses of medicupping for the kiddos. People maybe think, oh, that's a grown-up thing. It's like, not necessarily. It's super relaxing. It's very calming and sedating to the nervous system. So lots of benefits there too for those restless sleepers as well.
Wow.
One other one I want to make sure that we touch on before we wrap up this episode is that I believe you have quite a bit of experience of working with kids that have special needs. So tell us about your experiences with that and what types of therapies you're typically helping them with. Tell us about working with that population.
Sure. So I became drawn to that population even back as a nursing assistant before nursing school and all that way back, and just loved that. When I moved into the craniosacral realm, there was a lot of training that I went through working with kids with autism or, somewhere on the spectrum or other issues. Had some issues with different challenges with a couple of my own kids. We homeschooled. So I was, it was very apparent and I was there and had to get really creative in how I taught and how I worked differently with each of my kids, and kind of brought that awareness into the bodywork realm too. So maybe a parent, came across something saying craniosacral therapy might help my child that has autism. That child might come in and might be absolutely non-receptive to that light touch, and they might need deep compressions and joint compressions. And all of a sudden, they're not randomly bear hugging other kids in school because they're getting that outlet. So it's not a one size fits all, I think, with everybody, but especially in that special needs population, it's great to have a range of tools that you can go to. And sometimes those kids over time, will become receptive to that lighter touch and we can start doing cranial work, but it might be a long ways off. And sometimes those kids with special needs have been able to, find some support in terms of funding or things and come in regularly, especially during the school year, just because it makes such a difference that, their teachers are noticing. It's like, what are you doing? Because they're just functioning better in the classroom setting.
Yeah. And what a great way. I'm so glad that we brought this up, because what a great way to give some of these families some hope, right? On additional ways that they can try and support their kids.
Absolutely.
Yeah. That's amazing. Is there anything else that you want to talk about when it comes to pediatrics specifically?
We love kids. We really do. It's one of my favorite things that kind of lights me up is, just working with growing families, and, whether it's the tiny babies, those teen athletes that overdid it, or, kids dealing with test anxiety and high stress around finals time. It's like, what better thing, even if it's just like a half hour, to get them in for a massage and help them relax and unwind in the middle of that chaos.
I think what you're doing is so important. And I, for those of you that don't know Dawn personally, anytime you talk to her, she lights up when you talk about supporting moms in that season of hardship, but also supporting families and kids like this. I can just tell on her face that she loves supporting this population. So Dawn, how can people find out more about you if they want to ask you some questions?
Our website is Soteria Wellness, LLC.com. You can also find us on Facebook and on Instagram. We do have an event coming up September 25th, Who We Are, What We Do. That'll deep dive a little more into the nuances of all the different things that we offer. Time for some Q&A and kind of touring the facility and getting your questions answered in terms of where do I start? Because you got so much cool stuff here. So
yeah. Well, and I think especially as we're talking about growing families, kids are constantly I feel like every day I wake up and I go, we're in a new phase, or the kids are changing now, or is that you're saying your knees hurt? Is that because you're growing? Like, I just don't know. So I think having you in their back pocket to know that anytime they're going through these different phases or changes of their kids, that you're someone that they can lean on is going to be really important. So that event sounds awesome. And we do want to mention to listeners that Dawn is offering 5% off any item in her wellness store. So when you, of course, head over to her event on September 25th, you can check out the things in her wellness store. And if you mention this podcast, you can receive 5% off. Thank you so much, Dawn, for talking about pediatrics with us. This was super enlightening, and I definitely learned a lot. Thanks for joining us.
Thank you so much.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.